I once turned a newborn heel stick into a murder scene, all because I trusted a YouTube video over actual experience. As a new grad nurse, you are being sold shortcuts and hacks, but the truth is, friend, there are no shortcuts in nursing.
Did you know that YouTube University can be an absolutely dangerous resource if you are a new grad nurse? Now, I want you to know that it's not your fault if you're relying on YouTube or TikTok University to grow your skills. I think the nursing profession made a mistake in response to the pandemic by shortening your clinical times, helping you learn things via videos, and then the hospitals made mistakes by shortening your orientation time, really cheating you out of the time that it takes for you to grow and become confident, competent, and independent in your skills. But what I want you to know is that there are much better resources. And I want to share with you why 5 reasons why YouTube University is dangerous and where to go instead. So, number one, misinformation, inaccuracy, and lack of peer review. Let's face it, anybody can say that they're a nurse. Anybody can say that they have great skills, and anybody can show you anything without any evidence based practice, without any peer review, without any checks and balances to make sure that what you're learning is actually accurate. And you probably are finding out that when you come to the hospital and start working, we are big on evidence based practice, meaning the things that we do, the ways that we do them, the reasons that we do them that way are all based in evidence and support the very best outcome for our patients. So when you're learning things on YouTube or TikTok, you might get some good ideas, but are those ideas accurate? Are those ideas based in evidence? Are those ideas reviewed and vetted by peers who know the right things to do for your patients? You can't trust everything that you see on the internet. So instead, ask your educator about videos or resources or articles that are evidence based and peer reviewed on the subject that you're wanting to learn more about. That is a better resource. Number two, the danger of TikTok or YouTube University is oversimplification of very complex skills. So it's super duper difficult to put a video into short form format and like truly share with you the depth of how complex these processes actually are. They might give you like the Cliff Notes version and omit clinical rationale. They might omit any variations. They might omit contraindications, which gives you a false sense of like a really complicated skill. You're like, oh, this is super easy. I got this. When the truth is, if you go to actually get into it, you realize that it's way more complex than the video initially showed. So be very, very careful about what you're learning. A quick example for myself is I was actually using YouTube University to see how to do a heel stick on an infant. Like my heel sticks looked like a murder scene, and oftentimes the blood was hemolyzed because I just was not getting solid information on all the things that I had researched and all the videos I'd watched and all the things that I tried. And like each video omitted a little specific detail or a nuance that made a huge difference in my heel sticks. So when it comes to skills that you have not yet mastered, go to somebody in your department who has mastered them and ask for their help. I ended up going to one of our techs. We had a tech that used to work in a pediatrician office, and he did heel sticks on infants all day, every day to check basic blood numbers for these infants. And I was like, hey, I really need to learn how to do this well. And so far, all the techniques that I've learned online end in a complete disaster. Can you please show me? He took the time, he showed me the nuances, he explained the rationale, and he talked about all the different ways in which he got blood. And let me tell you something, I never have a problem with a heel stick now. I know exactly what to do because I went to the correct resource. I went to somebody who knew the evidence behind it, who had the experience with it to have mastered the skill. Go seek out the masters in your department to learn those nuances. Number three, relying on YouTube University gives you a false sense of competency. Because this day and age, it's very easy to watch a video, especially if you were trained through COVID and you watched a video and were given a little test and deemed competent. I'm sorry, but that was not fair to you. Watching a video does not validate your competency. Hands on, getting your hands dirty with these skills is what's going to help you become a competent, confident, independent, masterful nurse at your different skills. So you might watch a video and have a false sense of confidence that you know what to do and that you can do it. And it might lead to unsafe practices without supervision or hands-on training. I think like using myself as the example of doing a heel stick with everything I learned on YouTube University, what it did is it caused undue stress for the baby. It caused undue stress for the patients, and it had to be redone because my results were crap. Like the blood was hemolyzed because of the techniques that I had learned that I was like, okay, now that I've seen this, I could totally do this. And the truth was I couldn't. It was a total mistake. So again, watch a video, sure, keep your mind open, but at the end of the day, your best resource is the seasoned staff in your department who have mastered that skill. Not just practicing it, but could do it with their eyes closed because they've done it so many times. That's your very best resource. Number four, watching a YouTube video or a TikTok does not help you develop your critical thinking. And at the end of the day, that is the number one skill that nursing will require you to master, especially this day and age when everything is checkboxed and protocols and laid out there for you in a nice list. You have to be very, very, very intentional about developing your critical thinking skills, about asking why, about asking what is the evidence behind this activity? Why do we do it this way? Why does the evidence support doing it this way versus this way? Passive watching discourages clinical reasoning. It discourages the ability to adapt to more complex and more dynamic patient care situations. This job demands that you grow your ability to think critically. I think that we're in a time of nursing that is both helpful and incredibly damaging. It's helpful because it sets out the check boxes of what you need to do, but it's damaging because it's teaching you to rely on the checklist, on the monitors, on the numbers for your skills, for your clinical reasoning. And that's just not true. So let me share with you, I got into a situation with one of my new grad nurses. She had a patient come in VTAC. The patient was awake. The patient was talking. The patient had a somewhat decent blood pressure, but overall felt poorly. So a stable-ish VTAC. But at any point, that patient could have become unstable. And so she was kind of running around like, oh my gosh, look at the monitor. He's in VTAC. And I was like, awesome. What are you doing right this second? And she said, I'm getting stuff to start an IV. And I said, okay, if that patient stops breathing and goes unconscious, is the IV going to help you? And she's like, well, sure. I was like, but what's the treatment for VTAC? She said, shock. I said, right. So do you have the pads on the patient? Is the monitor ready to go if you need to shock that patient, whether you have an IV or not? She's like, oh my God. So we stopped what she was doing, went and got the crash cart, put the patient on the pads. And then through the course of treating the patient, we ended up having to sedate the patient and do an electric shock. And our pulse ox wasn't working. So when you sedate a patient, you do need your pulse ox to be working. But we went ahead and sedated the patient, and then our monitor totally went on the fritz. We did not have that reliable information. And she kept looking at the screen like, it's not working, it's not working. I was like, okay, but nurse your patient. look at the patient. The patient's respiratory drive was starting to slow down. You saw less breaths. You saw that the patient's face was starting to get a little bit dusky. You started seeing a little bit of blueness around the lips. I said, these are all signs that a monitor can't tell you that indicate that we need to start bagging this patient. The sedation that we gave this patient was just a little bit too much. There's no need to panic. We just need to support him in breathing while the medication wears off. So we got out the bag, we adjusted it, we made sure we had that good EC grip and good chest rise and fall as we're bagging the patient nice and slowly. And this is the moment where you develop critical thinking, because a video will tell you what's your oxygen saturation. It doesn't freaking matter. You can look at the patient and see that he's not breathing well, that he's starting to get more pale, that he's having signs of poor perfusion. And the next thing you need to do is bag the patient. You can do that without a monitor. That's an old school assessment strategy that you probably didn't learn, or if you did learn, you learned it for like 2 seconds and then they moved on teaching you how to read the monitor. When that skill is directly developed by watching the patient, by learning those nuances, by critically thinking what's happening to the patient, regardless of the nonsense going on with the monitor. So again, I can't stress this enough. Critical thinking is the number one skill that this profession will require you to develop in order to become a masterful, confident, competent, independent nurse. Number 5, danger of using YouTube University is those videos often have incomplete details. Like, how many times did you learn an evidence-based technique and you go into the hospital to execute this technique on a patient, and all of a sudden there's a nuance that you didn't expect? Maybe the veins are weird, or they blow easily, or there's a elderly woman with her urethra has like kind of tucked into the vagina and you can't find it. These are nuances that you cannot learn from a YouTube video. They're nuances that you can only learn from a seasoned nurse who's been there, done that, got the t-shirt, navigated all the nuances, and is absolutely masterful. So one example is I was newer at putting in straight calves in infant males. And the first time that I did it, I was expecting it to be just like with an adult, where you slide it in, you get the urine, you wait a few minutes to get the sample that you need, and you pull it right back out. So I got in and I hit resistance. And with an adult male, when you hit resistance, it's often because of the prostate. So you can kind of adjust the penis up or down, or like there are some strategies to like help you get past the prostate. But I was thinking, this is an infant. He doesn't have a prostate problem. Why am I hitting resistance? So I used my critical thinking to say something doesn't feel right. It doesn't feel okay to like force through this. I'm going to stop what I'm doing and I'm going to go ask questions. And luckily, the physician I was working with that day has a background as a pediatric nurse before he went to school. So he's learned all of these nuances. And what he shared with me is something that I didn't know. There's actually a sphincter in those little tiny penises that when you hit that sphincter, it clamps down. And he said, you can force the catheter through, but it could cause some trauma to that sphincter. And I don't want to do that. So he said, the strategy is you hold light pressure against the sphincter in that little tiny penis and you wait it out. Could be as long as 30 seconds, could be as long as 45 seconds. That process of waiting for that sphincter to release can feel like forever when you have parents in the room that are on edge already, the baby's screaming its face off, and all you're doing is sitting there waiting with pressure against that sphincter. What will eventually happen is that sphincter will release and you'll be able to get past it and get into the bladder without harming the baby. Now, there's no way that I could have learned that. I was using all of the evidence-based techniques that I had learned, like sterile procedure, shooting for the right hole, right? Making sure I kept everything clean, like sterile, and like all those little details that you learn in evidence-based techniques. However, I didn't know that there was a sphincter, and I also didn't know that it could literally take 45 seconds. So you're sitting there in this excruciating patience with light pressure against this little tiny sphincter of this crying baby to then get through. And you don't know it until you see it. So I had seen it, I had done it, I had learned it. I had waited up to 45 seconds with one kid, like thinking, oh my God, is this sphincter ever going to relax? And then I was able to teach that skill to another new nurse. He ran into the same problem. He hit the sphincter and he thought that he was actually all the way in the bladder. And he's like, this child has no urine. We're going to have to try again later. And if he hadn't learned what I had learned because of that experience, because of leaning on somebody masterful, he would have continued to think that when he hit resistance, he was in the bladder and the bladder was dry. And that's something that you can only learn by having the complete details that only in the moment, elbow to elbow with a seasoned nurse can teach you. So please, please, please just know that I understand why you run to YouTube University. It's an easy resource. It's quick to look things up. You don't have to bother the other staff to get the information that you need. But the truth is, you have to lean on the seasoned staff in the department in order to become masterful. You cannot rely on YouTube University to teach you everything that you need to know about the nuances of evidence-based, peer-reviewed, accurate patient care. So don't be afraid to ask. And this is kind of going back to other videos that I've made, is knowing who your go-to people are, knowing who your advocates are, knowing what nurse you can ask that will be willing to pause what they're doing and support you through the process. If you're not sure who that is, go back to my previous video and look up tips on how to choose a mentor or a preceptor wisely and start developing that skill of knowing exactly who you can go to in those moments so that you can become a masterful nurse. Remember, you are the future of nursing. As a seasoned nurse, we are your hope for learning, and you are our future. So don't be afraid to seek, to ask, to learn, and to dedicate yourself to mastering those skills. Until the next perfect time, much love.